Hello, everybody. Thank you for the opportunity to be here. My name is Nir, and I'm the CEO and co-founder alongside Eric, who is here with me from Canada. And we're building a company that builds medical devices. We did land a few hours ago, so if I fall asleep during the presentation, please excuse me. So I'm here to talk about something that's a massive unmet need, but it's not really being talked about a lot. And it's called eye floaters or vitreous opacity. So it turns out that 52% of adults have eye floaters. And I'll just make the assumption that everybody here in the room knows what eye floaters are, and probably most individuals in the room have some sort of eye floaters. And of course, some of us have severe floaters, which really impacts our ability to do daily functions like reading, writing, driving, etc. And so today, one of the main challenges and one of the main reasons why it's not being talked about as much is there's just no well-established way to treat eye floaters. So there's no approved FDA medical device that's non-invasive to treat eye floaters. The only option is to do what's called a vitrectomy. Of course, it carries some risks with that. Or YAG laser vitreolysis, which in the US is technically off-label, and there's some concerns around risks with YAG laser, and also it's a very manual approach to treat floaters. So we're building the world's first non-invasive treatment for eye floaters using 3D image-guided femtosecond laser treatment. We're building our system to be highly precise, automated, and make it an office-based procedure. So my hope for the presentation today is actually showing you where we are in the development stages. So when we are building this image-guided femtosecond laser treatment, the concept here is that we're tracking and imaging those floaters. Using that tracking and imaging, we're imaging them in 3 dimensions, and then we're delivering femtosecond laser volume treatment in order to eliminate them. So it's an image-guided treatment, so the first step is to be able to image those floaters. And so we can image floaters. So we've imaged more than 220 eyes to date, and we've shown that we can capture high-quality 3D volumes of these eye floaters, and then also be able to quantify different metrics of what's their shape, what's their size, what's their opacity, how do they behave. And then we're starting to understand the distribution of floaters within the population and how do we characterize them. The second step is, of course, it has to be safe, right? And so we've done experiments on, I think, more than 20 porcine eyes, more than 20 porcines and more than 40 porcine eyes to date. And so we are showing that with our treatment patterns that we're developing, we have about 12 times safety buffers to date. And we can essentially treat up to 2 millimeters away from the retina while being safe. The other thing that we're doing is also we're developing effective treatment patterns, right? So we need to image, we need to be safe, we need to be effective. And so what you'll see in the next video here is actually an example of us testing different treatment patterns and then showing that they're actually effective. And so this illustration here is just to show you what you're gonna see. So there's gonna be a tank that's filled with artificial vitreous. And this tank essentially have optics like a human eye. We developed that, and then we have tweezers in the middle that holds a collagen clump that behaves like a floater material. And so you're seeing here, we're essentially imaging. We have a camera that looks in the back. The femto comes one way, the camera is on the back, and then we have the collagen fibers, and you can see that we can essentially either remove the entire piece of collagen, or we can cut a piece of 1 millimeter cube inside. And so 1 millimeter cube treatment takes about 20 seconds. So this is the same, just showing you the before and the after, right? So the top section, you have the pre-treatment. So on the left here, you can see how we're eliminating that entire collagen piece. And then on the right, how we can, essentially, if we want, we can cut a cube outside of that. So what you're seeing here, of course, so we're working very hard to get to our first in-human treatment studies. And so what we're doing is we're doing a lot of work in the lab on test vessels, on ex vivo pig eyes. And so we're essentially building the whole workflow and device, of course, to be able to prep the eyes, dock onto the eyes, and then do imaging, calibration, and treatment. And this is our essentially first-in-human treatment system that is being currently developed and will be submitted for first-in-human approvals by the end of this year. In order to make it happen, of course, we built a world-class team. So myself, Eric, and our CTO, Das, and then we built a world-class board of directors to help us get there. And so, as I said, our objective for this year, next year, is to complete our first-in-human clinical study on treating patients, of course. And what I hope you take away from here is really what we're doing here, right? So we're trying to solve a massive unmet need. We can image floaters, we can do it safe, we can treat them effectively, and so the next steps is really moving towards showing that in humans. And if you really want to learn more and ask us about our progress, what are we doing, so feel free to reach out. I'd love to connect with you guys. That's it. Thank you.